Thank you all for coming. I would appreciate it. So, as Jessica was saying, thank you very much. My name is Dr. Tyler Sorensen with Wisconsin Rural Orthopaedics. I am a fellowship trained and board certified foot and ankle surgeon. Now, I've been with Wisconsin Rural Orthopaedics for about 2 years. Originally from Wisconsin, Madison, born and raised. I have 4 kids under the age of 5, so take a bank, crab crank. I need it. And I have a wonderful wife, Amanda, who has definitely the harder job. So thank you to her for letting me be here tonight as well to chat with you guys. So tonight we're going to be talking about trying to understand, give you some information on, hopefully you'll learn something about the foot and ankle. And I'll be talking about some of the more common things that I see in the clinic on a day-to-day basis. Hopefully glean some information or get some of the questions that you have answered at the end. So please, again, don't hesitate. That's what this is for, okay? So again, welcome. From Madison originally. Then my training started at Bethel University in St. Paul, Minnesota for undergrad. And I did my podiatry/medical school down in Des Moines, Iowa. A nice city down there, beautiful if you haven't been. Then kind of did a bit of a Midwest tour, headed back up from Minnesota. Did my residency at a level 1 trauma center in St. Paul, Minnesota at Regents Hospital. And then I decided to do a reconstructive fellowship in Chicago, Illinois for advanced reconstruction of the foot and ankle, where we did anything from total ankle replacements to complex reconstructions from flat foot to high arches, severe arthritis, hip deformities, and things, so that I could come to a place like this and provide those types of services to you all. So here we are. We all know the importance of our feet and ankles, and if you don't yet, you will at some point, right? Some of the more obvious things and reasons why it's important, right? Our feet carry us every step of the way. Everywhere we go, everything we do, our feet and ankles are there to do it for us, and if they hurt, well, you know it. And a lot of the people that come in will say, if my foot hurts, my whole body hurts, because, I just can't do anything, can't take a step without it. And as we know, mobility is freedom, right? Once mobility starts to go away, well, then our options start to go away as well. So understanding how we can navigate foot and ankle pain and mitigate it, if not completely get rid of it, so that we can enjoy life, so we can get on with life and do things that we want to do. Because foot and ankle pain can be debilitating, right? It can be debilitating. Some of the worst pain, they'll do studies that show that ankle arthritis is up there with some of the worst pain that you can experience, and it's a quality of life killer. And so it's important to know your options and to be able to have those. Another important thing to know is that many foot and ankle conditions are progressive in nature, meaning it's important to nip them in the bud before they get to be something much larger, okay? Because they are progressive, they get worse over time, the deformity gets worse over time, the arthritis gets worse over time, and it's harder to manage if you just let it go and ignore it, okay? So it's important to get care sooner, because I can help you get control of it a lot quicker and easier when it's earlier on, okay? So don't hesitate, okay? And another interesting fact is that many systemic conditions can actually present themselves in the foot and ankle first. So whether it be neurologic conditions, vascular or blood flow issues can present themselves first in foot and ankle, or systemic issues like rheumatologic disorders may present them first or only in the foot and ankle. So it's a very complex system with feet and ankles. They don't just carry us, they can explain our overall health quite in depth. So the foot and ankle is a complex set of bones and joints and ligaments, tendons, you name it. It's got it right. The foot and ankle contains 28 bones, okay, 33 joints, and over 100 muscles, tendons, and ligaments. Not to mention the blood flow, different arteries and veins and nerves, etc. And again, it's essential for mobility, balance, and overall quality of life. If your feet hurt, your body hurts. Early recognition, treatment, I can't push this enough, can prevent complications and more difficult conversations down the road. What's special about the foot and ankle? Well, they are uniquely engineered for bipedal locomotion. Okay, they are a complex set of joints with triplane, meaning they don't only function in just one plane or two planes. All the joints work together in a triplanar set of motions that are all interrelated to help you step, flatten out, and then push off again. Okay? And so it's a complex set of these joints that all work together to get you down the road. It's filled with the dense sensory receptors to a fine motor control and balance, right? Intricate ligamentous network provides both mobility and stability. It has to be mobile but stable to accomplish what we need to have done on a daily basis. The blood flow to the foot actually has redundancy to it on purpose to allow for good perfusion and healing of different conditions. And again, it's essential for upright gait, yet vulnerable to unique pathologies. So it's a complex structure with complex problems. Okay, so let's talk about some of the most common issues that people come in to my office complaining about below the knee. Probably the number one, is plantar fasciitis. Heel pain in general is what drives a lot of people into my clinic, okay? There are a handful of different things that can be going on with your heel, but plantar fasciitis is probably the most common one. It's an inflammation of the thick band of tissue on the bottom of your foot, okay? It attaches your heel to your toes. It's kind of like the rebar to your foot. It helps support the foot structure, helps produce what's called the windlass mechanism to provide a stiff support to push off of. And it is very easily irritated, and I think if you haven't had it, you might get a bout of it at some point in your life because it's that common. Okay, overuse is one of the main causes. Okay, running, standing for long periods, flat feet or high arches might seem contradictory, but both of them have their own issues related to the plantar fascia and can cause inflammation of it. Obesity is certainly a driver of this, as more weight, more force, more pressure down through that tight band tissue can cause inflammation of it. Poor footwear certainly can play a role, okay? Unsupportive footwear is certainly something that brings a lot of people in because if you have foot pain, footwear really matters. And then tight calf muscles have a real big role in heel pain and specifically plantar fasciitis. If you have heel pain, I'm going to be testing your calf stretchiness or laxity to see, and it's 95% of the time it's tight. And that's the main driver for it, okay, for the plantar fasciitis. So we'll have a long, in-depth conversation as it pertains to your tightness of your heel or your leg muscles and how it drives into the plantar fascia. So plantar fasciitis, how do we differentiate between plantar fasciitis and some other heel pain? Well, it's sharp stabbing pain like many of them, but it's those first steps in the morning that really hurt. Okay, after you slept for overnight, and then you get up and you take those first few steps, and they are really dreadfully painful. That is probably a sign of some plantar fasciitis going on. Or if you sit on the recliner for a while and then get up and get walking again, it's after letting things cool down and then getting back up and going. Those first few steps. Okay, treatment for this: stretching exercises. Stretching exercise for your calf. Okay, to get the calves loosened up, to take the stress off of the plantar fascia, to get it to calm down. Supportive shoes and inserts, anti-inflammatories and ice. Physical therapy can be helpful at times as well if it's recalcitrant, meaning it's not getting better for us. Night splints or stretching splints that help us stretch when we're not standing, right, while we're watching TV at night. And sometimes injection where necessary just to get the inflammation to tamp down. And I'll tell you, 85% of people will get better with these standard conservative treatments, especially if you come in when it first starts and don't wait too long. Because if you wait too long, it becomes chronic and the body stops recognizing that it needs to heal it and it doesn't know what to do, so it just shuts off. And so sometimes they struggle with that, and then surgery is sometimes needed to fully relieve the stress and the inflammation and get it to go away. So we want to avoid that, right? Next topic, bunions. Okay, you probably know somebody who has them. Maybe you have them yourself. Okay, it's a bony malalignment. Okay, of the big toe. Okay, there's the metatarsal bone right here that drifts out of position. Okay, it's not just a bone growth on your foot. It is actually a malalignment of the big toe metatarsal bone. Okay, and then the big toe drifts towards the second, giving us that deformity. Causes genetics. You can thank mom or dad for it because it is almost 100% genetic related. It can be exacerbated by wearing tight shoes, high heels, etc. But those are not the causes, although folks think that is the case. It's not. There's another thing about this, that it can be the beginning of flat feet or progressive flat foot disorder. And so it's a sign of an overall laxity to the foot, and should be addressed in some way or another. Pain, swelling of the great toe at the base of the great toe, kind of on the inside of the foot there, although you can have what's called a Taylor's bunion on the outside of your foot. Okay, we're talking about the main bunion here on the inside of your foot. You can you have difficulty finding shoes that are wide enough. You can also start developing corns and calluses. And one of the lesser thought of issues is that when the big toe here hurts and this bone is not doing what it should be, number 2 can start having pain. Underneath your second toe, you can start getting overload, pain, corns, calluses, etc. because of your bunion. I might ask, does your bunion hurt? You might say no, but underneath my second toe does. Well, okay, that's because the bunion is abdicating its responsibility. It's not taking the force it should. So number 2 starts to really hurt. Okay. So treatments for this: wider shoes, padding, taping, orthotics. Maybe I hesitate putting that in there. I think it's anecdotal to say that it actually slows the progression. Anti-inflammatory medications for a short course, certainly helpful. But then surgery for persistent pain or difficulty finding shoes that fit. Okay. And the good news about bunions these days is that there are options. There used to be 130 different options to get rid of your bunion. Very few of them worked, okay? And if they did, well, then it was a stroke of luck, okay? So now we know through research what the best procedures are, and now we have it down to about 3 to 4 procedures that are the best way to take care of your bunion. And it's realigning or establishing or taking care of, rather, the pathology behind the pathology, or the reason behind it, okay? We know that there's instability, and so we need to address that, etc. It's not just shaving the bump off, which can historically be very painful, okay? Bunion surgery, I'm sure you've heard, is terrible and all these things, but it's not the case anymore. Bunion surgery can be quite a bit better, quite easy now. A lot of times you walk right away in a boot, and the pain profile is much better because we're not just going in there shaving off a bump. We're taking care of it in a much different way. And so folks that had surgery with me generally don't have much pain at all. And they're very surprised by it because of the horror stories. Ankle sprains. Okay, ankle sprains, very common issue. And we probably all sprained our ankle at some point or another, misstepped, went into a pothole, things like that. But what is it? It's a stretching or a tearing of the ligaments of the ankle on the outside. You can sprain the ligaments on the inside of your ankle too, but generally it's considered the ligaments on the outside of your ankle that get torn or stretched, and can cause a lot of bruising, a lot of swelling. You may even break my ankle. I should probably go get an X-ray and see, right? Cause again sports injuries, uneven surfaces, accidental missteps, etc. Symptoms: pain, swelling, bruising around the ankle, difficulty bearing weight, inability or instability, or feeling like your ankle is going to give away, right? You can't trust it anymore like you used to, that kind of thing. Treatment: what we need to be doing right away after is rest, ice, elevation, right? Compression, kind of the old adage. Bracing for a period of time, whether it's a boot or a brace, for just a short period of time. But research is bearing out that the earlier you can get into physical therapy, the better results you're going to have, because we reconnect the brain to the ankle to reestablish that connection and prevent chronic instability. Chronic instability is not able to trust your ankle just moving, going on through your leg. Okay. So we'll talk a bit more about that. Okay. Surgery in the acute phase is hardly ever recommended. Okay. Unless you have what's called a high ankle sprain. And that's, you've heard that in sports. That's a totally different issue than this exact one, but surgery is really never indicated for that. Long-term implications are the problem, though. With ankle sprains, you can get what are called osteochondral defects, or chunks of cartilage that get shaved off or chunked out of the talus bone, which within the ankle is this bone right here. With twisting or spraining of the ankle, that bone can be quite susceptible to those types of injuries. That's an issue because that's basically the start of arthritis. And again, you can go on to what's called chronic instability, where you just can't trust your ankle, or the ankle kind of slips in and out of joint as you walk, and such. So balance issues can come about. Tendon tears can happen during the injury, okay? Or because of chronic instability, they're overworked and they start to tear, they start to stretch. You can even develop ankle arthritis because of ankle instability, and again, inability to trust your ankle. So as you step, that ankle that foot kind of moves in and out. I don't know if you can see that, but I'll kind of do what I can too. Every step you take, if you have ankle instability, it does this. It's like a mini car accident because the seatbelt of our ankle is loose. So imagine getting into an accident. Every step and that joint slips. Causes instability, causes a feeling of I'm going to fall, I'm going to go down, that kind of thing. And it can cause other issues like the tendons on the outside of the ankle getting torn, the cartilage wearing down because these shear forces that happen cause the chondrocytes to actually degenerate and go in and die. Okay? So it's important if you have that sense, okay, I'll go back a little bit. If you have that issue, if you've had issues with ankle sprains, you just think it's normal because, well, it doesn't even hurt anymore when I sprain my ankle. Well, that's because the ligaments are already torn, and they're not actually sending those pain signals anymore. It's important to know what your options are because stabilization of your ankle is super successful. Okay, it's a very successful surgery, and people do quite well with it. Okay, Achilles tendonitis, back of your ankle, the biggest tendon in your body. Okay, it comes right down into your heel, inserts itself to help you push off. Okay. Helps you stand up on your tiptoes, helps you walk. It's the biggest tendon in your body, and it can get inflamed. Okay? It's what attaches your calf muscles to your heel bone. It is caused by overuse, similar to plantar fasciitis. Overuse, runners, athletes. Obesity can cause it. Sudden increase in activity levels. So if you're going too quick, trying to get back into shape, and you get going too quick, it can get aggravated. And again, tight calf muscles drive too much stress through the tendon, and the tendon actually starts to get inflamed. The cartilage within the tendon actually starts to change. It gets thick. You can feel it. It's thicker than the other one maybe, and it can be quite tender and painful. Again, swelling, thickening of the tendon can be associated with a bone spur, okay? Now, plantar fasciitis can be associated with a bone spur too, but hardly ever is plantar fasciitis with a bone spur. The bone spur is hardly ever the issue. Not the case here. Achilles tendonitis, you can get a bone spur, and that can oftentimes be a part of your pain profile, okay? Treatment, rest, and activity modifications, stretching, getting that calf loosened up. Heel lifts or orthotics to help take the tension off or give some slack to the Achilles tendons to let it calm down. Ice and anti-inflammatories. Physical therapy, super successful with this, can be quite helpful. And then again, at last-ditch effort, surgery might be indicated. Okay. Flat feet, okay, or you lost your arch. Maybe you never had an arch. Maybe it was how you were born and you just never developed one. Or maybe you fell or misstep and you felt a pop, and then all of a sudden now your foot has become flatter and flatter over time. Okay, all causes of flat feet, genetics or injury, right? And then weak or stretched out tendons because of injury generally or genetics as well. It could be accompanied by foot pain on the inside of your ankle and foot because of the tendons and ligaments that are being stretched on the inside of your ankle and or foot. And then because the joints are being overstressed, you can get joint and or pain on the outside of your foot. Okay, swelling is often accompanied by because of inflammation. Okay, tired, achy feet after standing or walking for long periods. Again, instability can be accompanied by this as well. Because the foot is flattened out and the joints aren't functioning the way they are supposed to, and the ligaments are stretched out, can all cause that unstable feeling, okay? And then it can actually drive knee pain. It can drive knee pain, hip pain, back pain, etc. Because when you flatten your feet out, all of a sudden you're going to potentially stress out those ligaments on the inside of your knee, get your back off kilter, hips, etc., causing those issues too. Treatment. Good supportive shoes and inserts, okay? That is certainly paramount. Baseline treatment. Making sure that you're in the right shoes, the right inserts for your issue. Strengthening. Again, the calf can be a big problem for this. If you have a tight calf, it could drive too much stress through your foot and overload the foot and actually cause it to flatten out. And then ankle brace can be quite helpful if you have the ankle implications. The tendon on the inside of your ankle can get overworked and overstressed, and so an ankle brace can help offload that tendon and those ligaments to help them calm down and get rid of that pain. Weight management, and then if it's chronic or these things just aren't working for you anymore, there is a possibility to actually give you an arch. Okay, it's not going to be the highest of arches, but to give you an arch, get rid of the pain and get your foot back underneath your leg so that you can more successfully walk without pain. Hammer toes. Again, we probably all know somebody who has them or have them ourselves. It's informing through the toe or several of the toes that bend abnormally. Maybe they're flexible and they still can move good, or maybe they're stiff and they don't move anymore. And so then you start getting these corns and calluses and different things like that. But causes is actually an imbalance of your tendons and muscles in your foot, as well as ligament failure in the foot as well due to other issues, can cause hammer toes to develop. Wearing too tight or ill-fitting shoes can also cause issues, probably not the deformity itself, but issues with the deformity, if that makes sense. So you're going to start rubbing, you're going to start having irritation to the toes because of the shoes they wear. Pain irritation on the top of the toe, okay, or the tip of the toe, okay? Because of shoe rubbing, generally, shoes don't always accommodate for hammer toes, and so the depth of the shoes just don't allow for that. And so you start getting rubbing a callus or maybe even red, or you can even get a sore there that can cause it. Or you get on the tip of your toe because the tip of the toe is digging into the ground. And your toe is supposed to be like this, where there's a fat pad on the bottom of your toe. When it goes like this, all of a sudden it's the toes digging into the ground, and that can be quite painful and tender. Difficulty moving the toe means that the hammer toe has become arthritic. Okay, generally it's no longer flexible. Roomy, comfortable shoes with soft tops. Trying to find those extra depth shoes can be quite helpful. Toe exercises and splits, more like. Be able to help try and flatten out that toe if you can with those types of things, just for comfort. It's not going to change the hammer toe. The hammer toe is not going anywhere. It's just how do we accommodate these, okay? Padding to relieve the pressure, and then surgery can be indicated. Sometimes, and early on, it's easy to fix hammer toes. You can often do it with a minimally invasive procedure just to release a tendon or so, just to kind of get them lay flat. The longer you deal with it, the more progressed it gets, the more difficult it is to care for. Ingrown toenails. Okay, ingrown toenails, what are they? It's the edge of the nail digging into the soft tissue on the side of the toe. Okay, often it is caused by shoes that bang into the toe, and maybe the toenail has grown too long, or maybe you've cut it too short, and it gets driven into the soft tissue. It's like taking a knife and which is the nail, okay, and getting a cut, but then just leaving the knife there. The body doesn't like it. It starts to get potentially infected, super irritated. It starts to form, starts to drain. It can even get infected. Okay. Treatments are from soaking with warm Epsom salts, early stages, to removal, either temporary or permanently, so it never comes back. Okay. And then arthritis of the foot and ankle. Okay. This is a breakdown of the cartilage just like any other joint in the joints, leading to pain, swelling, and stiffness. Specifically in the foot, this can be caused by flat feet or too high arched feet. Okay. This is that progressive issue. If you leave it alone, it's going to become potentially arthritic over time because those joints are made to function in a very specific manner. And so if they're flattened out like this, they're getting stressed, just like a brake pad would. If they're not being used appropriately, they're going to wear out, okay? Causes wear and tear. Autoimmune conditions can also cause arthritis. Previous injuries that break through the joint can cause arthritis. Long-standing on flat feet or high-arched feet, ankle sprains, and chronic instability can lead to arthritis in the foot or ankle. Joint pain, stiffness, especially in the morning or after activity. Maybe you get the gears greased up and you get the things moving and it starts to feel a little bit better. But by more you use it, the worse it gets, right? Reduced range of motion, bone spurs can form, pushing on nerves and different things like that. That can be quite painful in the foot as well because there's not much soft tissue. And so pushing on those things can cause pain. Anti-inflammatory medications, supportive shoes, and orthotics can be helpful for certain types of foot arthritis and even ankle arthritis. Bracing, injections can be helpful as well. And then surgery if those things fail, right? And just like the knee or the hip, you can replace the ankle, okay? It used to be that you had the fused ankle. That was kind of the gold standard. But now you can replace the ankle, and it has become, I believe, and I think research bears this out, that it has become the gold standard. It's a huge pain reliever, and it preserves motion, and which also relieves the rest of the joints of the foot and doesn't stress them out too. So ankle joint replacement can be a great option for the right patient. Thank you. In this poll, we'll take questions whenever you want. As a reminder, no referral needed. Okay? You can just come on in. We have walk-in clinic, walk-in provider. Jen Cockey, she'll help you out in kind of the acute phase. And then, yeah, so no referral need. You could come on in or call in and make an appointment.
How do you replace an ankle?
Yeah.
So how we get to replace?
So you take a little cut of bone here, and on this one, you plop in a couple metal components, and I'll back up so that you can see this here, right? So you see this joint here, okay? You take a little sliver of bone off here, and then there's metal, and a high-level plastic, basically, in between, that pops in between. You can kind of see the outline on this picture a little bit.
Can you get evaluated for? I mean, how do you know if you have arthritis, or say you have a pain, but not all the time, it just happens once in a while? Should you, if any, like I said, it's, there, but then it goes away.
That's nice.
But then it comes back again.
Right, that's so nice. It could be different factors, right? It could be shoe wear, could be activity related, could be terrain, right? So different joints play different roles in a lot of our motion, how we accommodate the ground. And so depending on kind of paying attention to the activity that precedes the pain would be helpful, right? Sometimes it's diet related. Sometimes it's, different things like that too. So it depending on what the pain is and what's preceding it and how it presents and things like that, concern. If it's arthritis, a lot of times it's overuse. Sometimes it's not wearing the right shoes, things like, or inserts, or things like that. It just really depends, kind of. Yeah.
Well, how do you know when you should come in and get checked out with, and if it's persistent, or if it's just every once in a while you have it, or?
I would come in when you have pain.
Okay.
Yeah, because then I can better evaluate where it hurts. It's really revved out, but that's a good good time to come in, because then I can really pinpoint it a lot better. That's when I would come in, is when it's really revved out. Because when you're not having pain, it's hard for me to know, right? Even if you're like, it's kind of in this general area. Until I start pushing, which people love, till I start pushing on the structures that I know are susceptible with your foot structure, etc. It's hard to know.
Okay.
What's your belief on? I went to the foot doctor. He used to be here at the hospital, and now he's up October. And he says when you get older, you lose your cushion underneath your feet fat. It's like you got the cushion on your hands.
Yeah.
So then actually your feet hurt or burn because you only have the cushion and you're walking on your bones, more or less.
Yeah, that certainly happens, right? As we age, we lose our fat pad on the bottom of our feet. And so then our bones become more prominent to the ground. And so pressure can cause increased pain. Now, on the flip side of that, your nerves also can wear out, right? And so nerves can also become less sensitive or more sensitive in the process of losing sensation. You can start getting that burning feeling too. It just kind of depends, and again, it's hard to know without necessarily pushing, but yes, fat pad does atrophy. Okay, it does go away. Bones do become more prominent, and then so footwear or shoes and orthotics are much more important at that point, because
Injections. I've already had injections, and even have hurting feet and walk out before you get out of the car. More hurting feet.
after the injections,
Yes.
you have no hurting feet.
Right.
Good.
And the bigger the injection, right in front of that, the echo.
Okay.
But sometimes they'll last for 3 months.
Was it like a nerve block or what?
It's actually like, I think my cortisol.
Yeah.
You must do it too, right?
Cortisone?
Injections.
Oh yeah. Yeah.
So what type do you get?
All sorts. All sorts.
All sorts.
You name it, a joint that's in here, I'll inject it.
So where do you get the injection? Same place for that.
Here, and everywhere. I mean, probably the same place as you. I mean, you probably went to Jared Share. Was your guessing? What was your results? Pretty good.
Great.
They're awesome. They're the best. I have 100% success rate in injections. I generally pretty good. If it's gonna work, it will. Sometimes if you get an injection prior, cortisone doesn't work forever. It has lessening effect every time you get one, and so depending on the reason for the injection, it might work less the second or third time you get it. So if you come in saying, hey, I want that same injection, well, I might not get as much success through it as the previous doctor did because he did it the first time.
I'm not sure I dose cortisol, but actually it goes through the whole body. And goes actually this, but treats the feet, treats the ankles.
Yeah.
But if you got rosacea, you're going to get bad for a couple of days.
For sure. Right, anything we put in our body is going to go systemic to some level. Absolutely. Yeah.
You also do those shots.
Yes, I do. Yeah, and I mean, for what I know, people do really well. They say it.
Being with that, advertise on TV nearby. Within 7 days, you will have pains in their fingers, you'll have pains in their toes.
Right. Yeah, I heard of it. Nerves are finicky. When they start to go, right, depending if you're diabetic or not diabetic or have a neurologic issue or a rheumatologic issue or et cetera, really depends on what you got going on. But supplementation with B vitamins can be helpful to repair nerves and to sometimes even help them. It's anecdotal at this point. It's not well researched, but I see people feel better with some B vitamin supplementation.
Actually, that verify medication has B vitamins.
Yeah.
I take B1.
Yeah, so B3, B6, B12, all important. So it depends on the type of B. You can't just get a B vitamin and it's going to work. You have to have the right ones.
But the inserts for flap feet really don't solve the problem.
No, they're a symptom reliever, right? So there's symptom reliever, a support.
So you have flat foot and they got ankle. Like you said, it's the inside then. So then your foot is going to tip down. And when your foot tips down, it goes up to your leg and you got it inside your knee and it goes to the back.
Yeah. Yep. Our bodies are interrelated, so it's very wild.
That's any treatment for that?
Yeah. Ankle braces, surgery, injections, inserts. Inserts are the start. They're certainly not the finish. They're not the end-all, be-all. There is a solution, pretty much for everything.
Flap kit inserts hurt part up.
Right. If they're too far gone, inserts are actually going to hurt more. That's true. But you're not going to jump straight to surgery, right? So you have to start somewhere. So you start with inserts. That doesn't work. Okay, let's try injection. Let's try bracing. Okay, that's not working. Let's go with a custom brace. And it's still not working. Okay, well, here are your options. We can either deal with it or we can fix it. That's kind of how I run through it. So I mean, if you came in, you probably hear that exact same conversation.
It's all depending on, I think, the inject it for.
For now. Yeah.
I use an EMS foot massager to get some electrical pulses in your feet.
Sure.
That seemed to help.
Great. Yeah, I mean stimulation, right? What you're painting on. I'm not sure. I can't comment on all that much. I think, if it helps, awesome. Right?
So what
It might be. Sorry, go ahead.
what happens when your foot? I need my husband had orthotics. So what causes it like in one foot and not the other? Where it just seems that all of a sudden it's getting kind of worse to lose weight.
Yeah. Yeah, I think one foot versus the other. We use our feet differently. We lead with a foot.
So it would be orthotics. That's we covered it this year.
Okay. Yeah. We start with orthotics for sure. Yeah, absolutely. Yeah.
I got a question. Over a year ago, I fractured my foot, the same leg where I had 2 surgeries on my leg when I broke it. Okay, and anyway, a doctor took care of it, and then in March he released me. He said it was, everything was okay, and I didn't have to have surgery because it was not a fracture where you had to have surgery. It healed on its own.
Yeah.
For about a month, I wore a boot, and anyway, but now after all that, I wound up with hammer toes, and it's very hard. It always bothers me because it's hard to find a shoe that fits. Is it a good idea to get reevaluated, I think, to see what I can do to correct this? Because I got this hammer toe, and then sometimes they're flat, and sometimes they come up, and then that hurts me. Actually, I'm wearing an old pair of shoes because my Skechers that are newer hurt my foot when I put it in there, and then it's just very irritable. So I just wonder if there's something else I could do.
Oh, yeah. I see second opinions all the time. Right? I get people from all over the place.
Yeah.
From an hour, 2 hours, 3 hours away sometimes that come in my clinic and say, yeah, they told me I had no options. I'm like, oh, okay, well, here are the options that I see. And so I'm happy to help you.
Yeah, they didn't tell me that, but he just figured that I'd be okay now, but I got trouble and it hurts. I'd rather go to a local doctor than go, somebody from out of town. It's so hard to find a podiatrist in Wisconsin Rapids.
Well, not anymore.
Yeah.
Yeah. I know.
Here I am, in the flesh. Yeah, please.
How about peripheral neuropathy?
Yeah.
You treat that?
Treatment is tough, right? So, depends if you're diabetic, depends if it's just related to overuse or use and age, okay? But like I said, supplementation can sometimes be helpful, but laser treatments and different things like that are super anecdotal. I don't think they're not well researched. And I think to charge an arm and a leg for laser therapy that's going to cure your neuropathy it's a pipe dream of sorts. Okay, could it work for some people? I'm not going to say it can't, but also I'm not going to guarantee and have you put that much money on the line to help treat it. So I don't know if that's where you're headed, but
Could you treat it?
well, not really. I will say there are issues that can come along with neuropathy.
Yeah.
and that can be treated. Now, I can give you an idea of, if it's not diabetes related, is it your back?
My feet, both feet, front ears.
Right. So is it your back, actually? Okay. Is it so you probably heard of carpal tunnel?
Like you had both of those done.
You can get tarsal tunnel. So it's the foot version of the carpal tunnel. Okay. So if I was able to kind of do an evaluation, I'd be able to tell you, hey, this seems like you do have some of these issues, tarsal tunnel issues, or really, I think it's more up in your back, and we have a provider for that as well that I can easily get you into. See.
I don't have the problem. What's a solution for restless legs? Am I doing that?
Yeah, that's tough. Generally neurologic in nature, could be deficiency in different vitamins or things like that. Could be dehydration. Not sure. I think that's more a primary care question and concern.
But leg cramps can be a cause of not enough fluid.
Yeah, for sure. Yep. Yeah, so water is super important. And none of us drink enough for
Sure. What I think another problem with that is statins.
Sure.
I quit taking mine.
I don't know. Medications have they're positive and they have their negatives. That's why they're medications.
What's it a cure?
So stads are you for hub? Yeah, I tried 3 different ones.
Then what did it cure?
Well, those are just cuts your cholesterol down.
Yeah, no, but
I called it cramps and everything.
oh, that crap. Oh, but yeah.
Yeah. No, we wanted the cramps either. So I figured out.
Yeah.
Oh, what about your foster? In your church, aren't we? It'll salt us. Did you? Yeah.
Dang it, I don't know.
Fruit tolerance stool.
Big question. Yeah. Insurance. Sure. I am not a specialty on that. Go ahead.
And I'm a healthcare below what found it 100%. Over and I healthcare. Right? So the next best option probably is Humaniplant. The radio.
Get re up. I did that for years.
I can't speak to that prop.
So yeah, those type of river supply.
You never worry.
We best accept them in.
Yeah.
That is shit. I believe you do, yeah.
Yes.
Yeah.
We do it.
Tuscany, I know much more on
Yep.
that than I do.
You accept any insurance?
Yeah, we take all insurances.
Yeah, that's what I thought.
Each plan is pretty specific, but if
Your
you
own plan was virus.
not through us, but we take all because we're independent, so we take all insurance types. Yeah. So if you call the office, they can do the.
United Healthcare. Taste a lot of the iron.
Yep. Right now we have United Healthcare.
Just too much.
At the end of the year, it's being negotiated. So through A&I Network. So some people have got letters already, but it's not a for sure.
I got a letter for the first time in 20 years that I've been retired where you got to reevaluate what you want. And I don't really understand it, but I'm going to be working on it. I'm going to call the insurance company and figure it out.
Yeah, call your insurance company and see if they'll cover us, but we accept all insurance.
Well, they'll probably cover everything I already have. That's what you're supposed to check. That's what they want. And they want you. I guess you have some different choices now with all this change in from the federal government. I don't. So, okay. Thank you.
Yep. Any other questions? All right, well, take a cookie on your way out. There's lots of cookies. Thank you so much for coming.
Thanks so much for coming. Appreciate it. We'll hang around if you have any questions.